Afternoon, everyone. My name is Dave Garibaldi, and I am a volunteer and board member with Healthcare for All Minnesota. And this event is coinciding with events all around the country that are celebrating Medicare this year, the 58th birthday of Medicare. And the reason is we want to save Medicare. Right now, Medicare is under severe threat. And it's not what you think if you haven't heard about this. It's not just the financing of it that we keep hearing. This is privatization that's killing Medicare right now. And it's insidious. Unfortunately, CMS is also complying with the insurance companies in keeping this going. In fact, those of us on traditional Medicare may end up losing that and be stuck in a managed care plan where profit takers decide our health care. So we're trying to let you know today exactly what's going on. I just wanted to let you also know that this event today, I had several people that have worked with me to put this together. We've been working on it for a couple of months. And I will introduce them. Lana Dell, she's in the back in the green. Gina Stiles, where's Gina? There we go. And we also had some help from a couple people from Plymouth area Indivisible. That would be Greg Layden and Clara MacGyver, neither of whom could be here today. And finally, from the state of New York, Scott DeNoyer, he's in the red beret there. He'll be talking to you in a little while, and he's in the new documentary, Healing US, and he, along with Dr. Jarvis, who will also be speaking later, will tell you some very interesting stuff, and stuff that'll make you mad, and I hope inspire you, because we have got to get everybody into this fight. So most of you know Senator John Marty. He's the author of the Minnesota Health Plan, which was first introduced in the Minnesota Senate in 2016, did not get so much as a hearing, and finally this year, thanks to the trifecta, it did get a cost-benefit analysis, appropriations for a cost-benefit analysis. So that's a huge first step to getting things done there. Now, Senator Marty, he's been on the front lines of fighting for this for years, along with a lot of other progressive causes. And he has agreed, and thanks to our videographer, Justin, over there, running the stuff, he has done immense work for us. Senator Marty contacted me a couple weeks ago and said, hey, I'd like to record a video greeting for you. And I said, great, let's go. So without any more pause here, let's get Senator John Marty from video.
Greetings as you celebrate Medicare's 58th birthday. It's a major event. It was a major step forward in American healthcare 58 years ago, giving the promise to seniors, people who were traditionally vulnerable both to poverty and lack of access to care, giving them healthcare and giving them a chance to have affordable healthcare. It was a wonderful promise, and it's now at age 58, it's beginning to age and showing signs of worsening. But unfortunately, that's not the problem of Medicare. Medicare itself was a wonderful idea. It didn't go far enough and didn't cover everyone, but it was a big step forward. And frankly, the decline of Medicare is not the cause of Medicare, it's the cause of greedy corporate interests. People trying to take over it, trying to get a cut out of it. The insurance companies coming in and say, we could do it more efficiently, and then charging more. They don't charge more to the patients, perhaps, but they charge more to the government. So the healthcare system, even in the best program that came out of the 1960s, program of Medicare guaranteeing this to seniors, even that's getting torn apart, but not by the idea of the program, but by the way corporate interests and the politicians who cater to them have done that. But that's the time why we have to speak up more forcefully than ever. Now is the time we have to turn back the tide towards Medicare Advantage. The program that was supposed to save money, but it basically made money for corporate interests. We're supposed to turn it back. We need not just to make Medicare whole, but we make it whole for the whole population. We need improved and expanded Medicare for all. It covers everything, including long-term care, including dental, including mental health, including all of a person's healthcare needs. We need improved and expanded Medicare for all. And you know, and I know that the politics of the times make that very tough at the national level, but it's so urgent, I think we have to fight for it at the national level and at the state level. State level, we're fighting for Minnesota Health Plan to provide health care to every Minnesotan with no exceptions for all their medical needs, and make it so that patients are in control. They and their doctors have the decision making, not insurance companies, not government, not employers, but patients and their doctors. They get to choose which doctors and medical professionals they see, and the decisions about their care are made between them and those medical professionals without outside interference. So now is the time we have to work together to get improved and expanded Medicare for all and Minnesota Health Plan. We try at the state and the federal level because it's such a huge challenge. And this year we made some steps forward in Minnesota. We actually have begun a cost analysis, a cost benefit analysis of the Minnesota Health Plan with its Medicare for all, truly Medicare for all kind of program, and compare that to the current dysfunctional insurance-based, greed-based system and see which one costs less. Because some people say you cover more people, it's going to cost more, but by getting rid of the bureaucracy, by getting rid of the dysfunctional system we have, we believe, and the evidence seems to show, that it's actually less expensive to take care of people. All we want on this birthday of Medicare is to have what the promise of Medicare was for seniors, and we want to expand that to all people. Namely, that we're going to focus on making sure we keep people healthy and getting them the care they need when they need it. We're going to focus on that, and in the end, it actually saves money. I join you in celebrating today. Wish I could be with you and look forward to working with you in the future. Thank you.
Hello, everybody. This is State Senator Jen McEwen from Duluth. I'm sorry that I can't be there today to celebrate with all of you, but I have some things up in Duluth that are going to keep me up north. But I wanted to be there with you today, if I could have been, to celebrate the birthday of Medicare and all of our efforts to try to bring Medicare for all and healthcare for all to everyone in the United States, and all of the work we do here in Minnesota to bring the Minnesota Health Plan to fruition and to realize it here in Minnesota as well. So thank you, everyone, to all of your efforts, and let's keep going. Let's do this. Happy birthday, Medicare.
I want to point out that there are several other legislators here today, and I hope there's more than I know, because I don't know every one of them on site. But Senator Liz Bolden is in the back there. Senator Aaron Murphy. Senator Bonnie Westland, and my old friend, Representative Kristen Bonner. Are there some other legislators in the audience that I don't know? Oh, yes. Mr. Elkins, yes. Thank you so much. I'm so glad. I sent letters to everyone, emails to every one of them, and hope to get a big audience here, because what you're going to hear today, a lot of our legislators don't know, because you can't hear it on mainstream media. So if they're not glued to what's going on in the deep reaches of healthcare journalism, they aren't going to know this stuff. So I'm hoping by next session that we can get everybody on board to really the reality of this situation, because it is grave. Well, I wanted to tell you the actual birthday of Medicare. It's not till tomorrow on July 30th. Which happens to be my friend Ann Jones' birthday.